Hi, I'm Liz Martin. I am a licensed massage therapist and birth doula, and I work in Lakewood, Colorado. And all of my doula clients are within the Denver metro area. And I am joined here today by Emily Kamala. She is a wellness coach and a distance cranial sacral therapist. And I wanted to have this conversation with her today about lymphatic drainage and the lymphatic system in the body. Since most of us are staying at home, social distancing, quarantining ourselves because of COVID, I wanted to do a series of self-care tips for people, for my clients mostly, who are unable to get a massage during this time. And so the self-care tip that I wanted to talk about this week was lymphatic drainage, because there is a ton of things that you can do for yourself that helps your lymphatic system to flow. And one of the benefits of massage is lymphatic drainage, lymphatic flow, moving all the lymphatic fluid throughout your body. But there's a ton of ways to do it at home when you're unable to get a massage. And so I asked Emily to join me today because she is way more knowledgeable about this than I am. I did a bunch of research this week and totally got really excited and really interested, but I would never be able to explain it in the way that Emily would, because she's brilliant and she knows a lot of stuff. So Emily, I'm going to let you just kind of introduce yourself, tell us more about your background and what you do, and then we'll kind of get into some questions.
Great. So as you mentioned before, I'm a craniosacral therapist, and right now I'm doing some distance work. So the way that we do distance craniosacral therapy is it's really unique because we work with people in terms of their sensory awareness and how they're experiencing their bodies. And that helps to actually release blockages that we're experiencing. And so I can get into that a little bit more as we continue talking. But I also work as a certified health and wellness coach. So people will get in touch with me about habits and things that they want to change in their lives and how they want to increase their wellness and shift their lives for a different reason. So it could be like a medical condition that's causing them to want to change. And it could be just an overall desire to increase their wellness in their life and increase their health. Outside of that, I've been practicing massage therapy since 1998, so I've also taught and done a few things along those lines. My training for craniosacral therapy is through the Upledger Institute, and I've gone through their entire core curriculum and then some other classes as well, so specializing in pediatrics and obstetrics and trauma resolution.
That's awesome. Well, thank you so much for joining me today.
Yay, I'm so excited to be here.
I'm excited to ask you some really geeky questions.
I love it. I love geeky questions.
So let's just start out by just, what is the lymphatic system and what is involved in our bodies that creates the lymphatic system?
Okay, so the lymphatic system, the way that it's almost like the trash collection system of the body. So it actually pulls things out of the bloodstream and it helps to move it through, and then it helps to clean the blood. So you can think about it from that standpoint. So if you can imagine that we have our lymph nodes, so we go to the doctor and they're checking your lymph nodes and everything else. Those little nodes, you can see them as like little places where the trash might come and collect, right? And then that will actually pull things out of the bloodstream, and then it pulls in there, and then it starts to move through. So it's like it has a stop and a go and a stop and a go, and it kind of moves like this. So when you're seeing a lymphatic drainage specialist, they do this beautiful stroke that kind of feels like this. It's not telling you what the lymphatic system is yet. But really what it is it's collecting all the things in the body that needs to be cleaned out of the bloodstream. So, and then it takes it and dumps it back into the heart and through these ducts through the thoracic outlet, or through the thorax of the body, the upper part of the body. The pieces that go along with it, so your key components are going to be like your kidneys and your spleen and your thymus, and you have also some pieces in your digestive system, so like through your intestines, that actually help to clean out and emulsify fats. So the lymph system is pretty big, it's pretty complex. If you have any problems with your lymph, things to kind of look at are underlying symptoms. So you might be wanting to actually check and see if there are any problems with your kidneys, or if there are any problems with your circulation, because a lot of these pieces go hand in hand. one thing that's different from the lymphatic system to the circulatory system is that circulation moves on its own. So it moves with the heart. It has its own pump. It has its own flow that way, where the lymph moves with muscle contraction. So one of the things that Liz had mentioned before, things that help, is actually getting out and moving your body. And so moving your body will actually start to move your lymph. So as we stay stationary, I love that Liz is bringing this to everyone's attention, because as we stay stationary with this stay-at-home piece, we're not moving as much as we need to. And so our lymph system will actually start to decrease and not function as well as it could if we were out and moving more. So some people might be getting out and moving more than they normally would, because they can take walks where they might have been busy all day with work. So some people might be seeing benefits, and some people might actually see, some decreases in that.
And so can you describe what lymph fluid is? It seems like a simple question, but I feel like, if you have like edema, right? Like you have been sitting for a long time on a plane, or maybe working, and all of a sudden like your ankles feel a little like there's like water retention there. Yeah. That would be lymph fluid, correct?
Yes. So that's going to be a little bit of swelling. So they call it the interstitial spaces. So the spaces in between different tissues. So when you start to get fluid flow that starts to get stagnant and starts to swell, so edema, things like that, that is definitely like lymph fluid that's getting stuck. So the main key component that I totally spaced out mentioning is that the lymph system helps with immunity. So it helps to move T cells, lymphocytes, and all those different things that help to fight infection. Okay. So what the lymph carries is glucose, proteins, and your immunity. So those are the things that you want to watch out for. Like if you eat anything that increases your glucose levels, that starts to affect your lymph system. And then fats, like I think I mentioned before, in your digestive tract, it helps to emulsify fats. And so, yes, like what you had mentioned, like when you see swelling. So for me, just personally, because this is my experience with lymph, is I get a lot of swelling in my armpits.
There's like a puffiness, right? So like around your lymph nodes, you can get puffy, like when you're sick, right? Like you like tenderness right here. And that's because your lymph nodes are working overtime to filter out all the gunk in your body.
Yes. And so what I attribute that puffiness to is like, another thing, some people might notice that they get numbness in their hands. That numbness can come from their neck, but it can also come from the pecs. Like if your pecs are too tight, that can cause compression through all the tissues in this space of your body. And so for me, I have a lot of tightness through my upper shoulders and my back, which decreases the lymphatic flow through breast tissue and through other parts. So then I get puffy armpits.
So when you have tight muscles, so all the reasons that we have tight muscles, be it stress or the way we sleep or not getting a massage or the way that we hold our body or muscle weakness, like that can contribute to our lymph fluid becoming sluggish because the tightness stops the flow. Yes.
So any kind of compression, any sort of tightness within all the tissues can definitely affect fluid flow. For sure.
Okay. Yeah. Oh, okay. So we talked about moving your body was one way to get your lymphatic fluid to flow if it feels sluggish. And so some other ways are like some self-massage, so I'm going to be posting a blog article and I'm going to put some different videos that I found that had some really good techniques for some self-massage techniques. I'm also going to talk about breast massage. Great. And I was kind of like geeking out over breast massage. I was getting really excited about it. Since we don't have muscle in our breast, the fluid isn't going to be pumped through and is not going to flow through like it will like the rest of our body. And so lymphatic fluid can sometimes pool in our breast, which is why breast massage can help help it to flow through. So that was really interesting. So I'm going to be posting some videos about a self breast massage.
Great.
Interesting. But then also like contrast baths, like introducing hot and cold to the body, because the vessels will like dilate, contract with the cold and the hot. But what are some other ways that you recommend people getting their lymphatic fluid to flow?
So the two things that have always been mentioned to me are getting in the water, which is something that we can't necessarily do right now. We can't go swimming, but swimming is a great way to get lymphatics to start flowing. Rebounders or a mini trampoline So I have one of those at home. And that's a big one. You can bounce on a rebounder or a mini tramp for a while and
What about a yoga ball?
So yeah, you can bounce on a yoga ball, but it's not going to get the whole system. So
Gotcha.
when you're thinking about like actually jumping on a mini tramp, you're getting everything. Whereas on a ball, you're just bouncing through like your core. So you're not getting your legs involved in that piece.
Okay.
But I don't want to diminish that as an option. Okay. So bouncing, movement, those are all big, big, big pieces. And the reason why the bounce with a trampoline versus like a jump rope is because you're not hitting hard ground where that becomes more of an impact. And that can kind of stop the system, where when you're moving with a trampoline, you get this kind of fluid flow that starts to kind of shake the system up almost, if you want to boil it down to something very simple.
Because lymphatic fluid has kind of like a slow kind of flow to it, right? So you want to kind of imitate that kind of flow, whereas like the hard impact, right? Like you're saying, like it is not congruent with the way that lymphatic naturally flows.
Yes,
that's true.
Yeah. So, and if that's your only option is like a jump rope or to move in that way, I mean, it's not going to be a bad thing. Like movement is one of the key pieces. Any kind of muscular contraction is going to start movement with the lymphatic system. So that's going to be one of your key pieces is what kind of movement can you do that has some fluidity to it. Okay. Trying to think of some other options. I think we talked about self-massage, but dry brushing can also be helpful. And so you want to be able to move it to your heart. So anytime you're doing a dry brush, you want to be able to kind of move it in a direction like towards your body, right? So you're going to start further away, so like at your hands or your feet, and moving towards your heart. So you're always going to be pulling up into your system, which is another reason why Swedish massage is so beneficial. So if you're doing self-massage, it's going to be pulling in towards your heart as well, and that will help to move things.
Yeah, I'm going to be in my article posting a really great video that I found about dry brushing, and it also shows great techniques for like the torso as well, because like for the belly and the back and all that stuff. So dry brushing for sure I think is helpful.
Perfect. So the main thing that actually stops or causes the system to become sluggish is going to be stress. So the two hormones that get released when people are under a lot of stress, which I think is the key right now, a lot of people are feeling an incredible level of stress at this moment, is like you have cortisol and you have adrenaline that are released into your system. Cortisol is one of the biggest effectors on the lymphatic system because it decreases your digestion and it decreases your immunity, and it also increases your glucose. So when you think about also increasing blood pressure, so we'll kind of talk about those pieces, like decreasing your digestion is one of the also key places for your lymphatic system to function. So you need healthy digestion, you need healthy peristalsis, which is the movement of the digestive tissues to get your lymph to move. It helps again to digest fats, and that's what's happening in your large intestine, small intestine pieces. Immunity, so decreasing your immune system obviously is decreasing your lymphatic system, because it's your lymphatic system that moves all the lymphocytes and the T cells and everything else around. So that's another piece. Increasing glucose, or the sugar, that is something that moves through the lymphatic system, but it's also, that's what feeds your cells. So when you have too much glucose in the system, then it starts to get stored as fat, and then that decreases fat absorption from a proper standpoint. And then blood pressure, when your blood pressure starts to increase, you're squeezing those blood vessels. So your blood vessels start to shrink and they get tighter, which is what increases your blood pressure. And when you don't have good blood flow, then you have lower lymphatic flow. So you need the blood flow and the lymphatic flow to move together to kind of help things go along. So any kind of stress relieving activities that you can do, whether it's meditation, everyone talks about meditation, but even just deep breathing, which is something, Liz, I think you might talk about as well, can really start to move the lymphatic system.
Yeah. So I did want to talk about like diaphragmatic breathing, and also how just the movement so diaphragmatic breathing, right, is when you take nice slow deep breaths and you really feel it. So your diaphragm is a dome muscle, and it's kind of on top of where your organs are, in between your ribs. When you inhale, it flattens, and when you exhale, it comes back up. And conversely, the pelvic floor is like the opposite kind of hammock muscles down by your pelvis. And when you inhale, they flatten, and when you exhale, they come back up. And so you have this kind of symbiotic movement, I like to say, when you're really focusing on the movement of your diaphragm as well as the movement of your pelvic floor. And when they're moving together, it's almost like a pump for your organs, I would say, in terms of moving blood and fluid through your abdominal cavity. And so I would say that in general, just is gonna, like, having that diaphragmatic breathing, if you can also pair it with like the up and down movement of your pelvic floor, you're going to really help to move that lymphatic fluid through your abdomen. But is there other ways, like, or other things that, like, just deep breathing and diaphragmatic breathing helps?
Yes. And when we're thinking about yoga, anything that kind of gets those larger muscles to move, so any kind of stretches that do that, twists, if you can go into a twist and focus on your organs moving the twist, or from your navel moving a twist, so you could just simply be sitting in a chair and do a twisting motion.
Yeah.
And then focus on the diaphragmatic breathing from a twist, from being inside of a twist, that will actually start to affect the muscle tissue and those organs in a different way. So you're starting to move and get things to shift from different perspectives. So if you think about Thai massage or any sports massage, when someone has you in a different position and then they do the massage stroke, or they have you contract in a different way, that affects the muscle tissue again in a more unique way. So that can affect the lymph system too. So if you have an area that has congestion, moving into different positions and having that deeper breath from different positions can help to kind of open all of that up.
So I always, like, envision that, like, the organs are like a sponge that's being wrung out. I don't know if that's accurate or not, but that's kind of when I do like a twist with the diaphragmatic breath, like, that's kind of what I envision is happening. So is there anything else that you wanted to talk about in terms of getting lymphatic fluid to flow that we haven't discussed yet?
I think, let's see here, dehydration is another piece. So just making sure that you're very well hydrated. I noticed since we've been in the stay-at-home order, I'm not drinking nearly as much. I would drink anywhere between 70 and 100 ounces of water a day. And now I'm probably at like 40 or 50, and I feel it. I feel a big difference. So that's on my radar of changing. So I just want to encourage people to make sure that they're still drinking a lot of water, a lot of fresh water that they can. And if you need to add anything to it, like, decrease those sodas, decrease the teas. But the water is going to be really important system. But warm fluids are always really helpful for the digestion. So if you can do room temperature water, then that's going to be a little bit easier on your digestion than like ice can be.
Okay.
Yeah, those are pretty much the only things I can think of that help. Yeah.
It's super helpful. Thank you. That was very informative. So you are a cranial sacral therapist.
Yes.
So when I asked you to do this conversation with me, kind of asking you, your knowledge and background about lymphatics, you brought up the cranial sacral thing because cerebral spinal fluid, which is what is being kind of like, I don't know, manipulated. I don't know what the right word is during cranial sacral therapy is considered, I think you said, a lymphatic fluid. So I kind of wanted to first just have you describe what is cranial sacral therapy, for maybe someone who hasn't heard about it before, and then, how it might relate to lymphatic drainage.
Perfect. So craniosacral therapy is a practice, a very, very gentle hands-on practice that affects the cerebral spinal fluid and all of its related structures. So that cerebral spinal fluid is in the brain and the spinal cord, and it affects the central nervous system. So that's what houses the central nervous system, is the brain and the spinal cord. And that cerebral spinal fluid helps to kind of bathe those structures, and it keeps them moving, keeps them, keeps them happy, keeps them healthy. And so that fluid has its own flow. So like when I talked about lymph, how it kind of has this kind of movement this way, CSF has more of it's a slower rocking. So I always tell my clients, it's like sitting on a beach and feeling the waves coming in and moving out. And it's a really gentle push and then a really gentle pull. And what we're looking for as craniosacral therapists is, how is that fluid moving correctly? And how is it affecting the tissue? So when that fluid moves, you can imagine that, as with anything, so like I think about a sweater. If I pull on a thread in a sweater, you're going to see it tugging somewhere else down the way. So if I I'll just speak from my personal reference. Like I've had concussions. So like if I have a concussion and it creates tightness in an area of my head, I'm going to feel that all the way down. It's going to affect other aspects of the body. So when that fluid pulls on part of the head or it pulls somewhere else, you're going to see that pulling like in my shoulder, or you're going to see that pulling in my back, because it's like that thread that got tugged on. It might not be the initial place, but it could be somewhere down in the sweater that you're feeling that tug or that pull. Does that make sense? Mm-hmm. Okay. So as cranial therapists, we're always coming back to what is that, the rhythm, the CSR, the craniosacral rhythm, or the rhythm of the cerebral spinal fluid. And that is kind of our home base. So we're always coming back to that place. And we can work at any point in the body. So we can work through the feet, we can work through the legs, the pelvis, the torso, and then all the way up through the head. And so your core structures of the brain and the spinal cord, we're always coming back to those pieces too. Okay. How it relates to lymphatic systems. I find that whenever I work through the diaphragm or through the belly and the pelvic floor, and feeling for the rhythm along the spine. So I'll be feeling it through the spine or through the sacrum. Those vertebrae will actually move. They'll have their own rocking rhythm with the cerebral spinal fluid. And then as that pulls through tissue around it, we can kind of feel where there are places that are stuck. And that's where craniosacral therapy becomes a fascial practice. So when we work with fascial techniques, so if you don't know what fascia is, it's that part where you pull apart a chicken, and it's that shiny white stuff between the meat of the chicken and the skin of the chicken. And that, like, oh, I love basting turkeys, because this is where I start to think about it. It's like, you know, you lift up that skin and you go right through it. So all that stuff that you're tearing apart as you're starting to baste the inside of a chicken or a turkey, that's the fascial layers. And so when you're pulling apart a breast, it always comes with the tenderloin, and the tenderloin always falls apart in the same place. And that's fascia that creates the delineation between these muscle fibers. So that's continuous throughout the whole body. And you can track the fascial system and how the cerebral spinal fluid will pull on the fascia. So if you have any restrictions in your abdomen, since that's kind of what I'm speaking of, you can start to get that to shift and change. And the more that I've learned about lymphatic work and feeling and hearing, you can actually hear the lymph start to shift and move as it starts to dump and change. Let me backtrack. As it starts to kind of shift through the system, you can actually hear it gurgle. You can hear it make noises. And it's a little bit different than your digestive system and your digestive sounds. And times that I've worked through there, I've seen significant shifting in people's like intestines or something else along those lines through the fascial layers. And they'll actually come back to me and say, wow, I've never had, this is kind of gross, but like their bowel movements are like increased, and they're moving things that they would claim have probably been in there for a very long time. Right. So that's moving all of that stuff through, because the fascial layers tend to bind. And if we can get those fascial layers to unbind, then you start to increase all the things that need to be moving properly. So that's how it can help the lymphatics from a body standpoint. When we look at lymphatics from a brain standpoint, there are no specific lymph nodes or lymph structures in the brain, but the cerebral spinal fluid is pretty much the same. It's comprised of pretty much the same things as lymphatic fluid. So if they're one and the same, then how, that brings up the question of how does that move through the brain? And what they're finding is this whole glial system, and these glial cells in the lymph system. And so lymph, but glial cells, just kind of putting those pieces together. That's with the blood-brain barrier. And so you've got this dura membrane that goes on the outside of the brain, and that's where you have like capillaries and blood flow. And then you've got the cerebral spinal fluid on the inside of the brain. And so that has to get cleaned out. It has to get taken care of in order to keep all that tissue healthy. So there's a filtration system that happens in that membrane, and that's what they call the glia or the glymph system. And that's that bridge between the craniosacral system and the lymphatic system. So yeah, the lymphatic system, it clears the waste out of the brain. So it kind of takes everything out, that like the dead cells and any other toxins that have built up. And then it also, these new components, it it brings them into the brain. So the brain, it lives off of sugar and fat. Like that's its jam. Okay. So it brings in the glucose, it brings in the lipids, and it also brings in the amino acids, and it helps to move neurotransmitters. So if there's any blockage in that lymph system, then we're going to be blocking all those pieces that help to increase and maintain brain function. So when you're thinking neurotransmitters and our knowledge that we have the gut brain where a lot of neurotransmitters are created, we're looking at how does that all move through. So if those neurotransmitters can be moved from the gut into the brain, then we need to help the lymph system to move those and create that healthy pathway.
Yeah, I'm just trying to like wrap my brain around it. It just seems so big, you know? Like
it is big.
It's so complicated, and I mean, I don't think that either of us would ever be able to like explain it completely. But you know, just how like all the pieces like work together, just like I don't know, the body just like blows my mind.
Yes.
It's so fascinating.
It is. It's this intricate web of connectivity that is just beyond fascinating to me.
Yeah. And then it's like, move your body and breathe deeply and it'll be fine. And you're like, okay, like it seems so complicated, but it's like some of the simplest things help for it to function properly, you know, like barring any other like larger medical issue like cancer or something like that. Yeah. So say you're working on the cranial bones, like what does that mean? Like if you're doing a session on someone and you're kind of working on getting that cerebral spinal fluid to flow through the brain or whatever, like what exactly are you like hands-on doing? Yeah.
When we teach like craniosacral level 1, the basic class, we actually look for bone structure movement. So we're looking at the sacrum and how does the sacrum move? So the sacrum is going to have its own little rock to it. Okay. And then when it rocks, it's going to pull what we call the dural tube, because there's a tube that connects the sacrum to the head. And so that tube is actually going to, it'll rock with everything, right? So the paired bone to the sacrum is the occiput, which is at the back of the head. And so those two bones are going to rock together, okay? And if you have any problems with that, where it gets stuck somewhere along the way, you're going to feel it. It's going to be like a little hitch. So, and so that's what we're feeling for in that movement. But again, we're always going back to how is the cerebral spinal fluid moving and how is it pulling, which makes it, we call it the cerebral spinal rhythm, the CSR. So we're looking for that in all aspects of the tissue. So if I'm in the head, the bones of the skull, they kind of come together in little sutures. And so there's the belief that it fuses, but it doesn't actually fuse. There's like micro movements, so it can actually play, okay? So those bones will have their own movement. And if that movement is stuck or if it's jammed because of, you know, a hit on the head or anything, like if you clench your jaw, like that can cause all sorts of jamming coming all the way up. Then those sutures start to kind of jam, they get stuck together. So they might try to move, like maybe the top ones are moving, but the bottom ones aren't. So then it creates a different movement in the bone that isn't optimal. And so I'm going to say optimal because it's not wrong, because there are a lot of times the body, in its desire for homeostasis, in its desire for balance, it will move around and it'll create a new pathway. And because the body's, its only concern is to have homeostasis, it's to have balance and to stay there as much as possible. So if you have an injury, it will find a way around that injury.
Coming back to our original conversation, you know, we're trying to come up with different techniques and strategies for people to do things at home, like while, you know, we're sheltering at home. And so what are some things that people could do at home related to craniosacral therapy? And like, what would be an indication that they should do it as well?
So when I think about craniosacral therapy, stress always comes to mind when it comes to really any system not working well in the body. And so if people are starting to feel overwhelmed, or they're starting to notice that they're having symptoms of any sort of, I don't even want to call it a disorder, but like a stress disorder of some kind. So you're not sleeping well, you're not eating well, you're not staying as hydrated, or you're starting to become more argumentative, or there are other things that are happening, then getting into your craniosacral system can be very, very helpful. Ways to do that, again, we've already mentioned a lot of these with breath and meditation and slowing down. The craniosacral system is hard to feel on your own. So like there are many practitioners that maybe aren't even aware of what their system is feeling and doing. So if you're what I want to call a lay person who doesn't even know about like these different types of body systems, it may be very difficult to become attuned to it. So I don't want to say, you know, if you feel X, then that's your craniosacral system, because it may not actually be that. But if you're feeling stress and overwhelm starting to hit you, that will start to shut everything down. And so breath and meditation are kind of your key things. Keeping your spine pliable is a key thing. So if you're doing any yoga or you're able to, like simply legs up the wall can help like lymphatically. But things that I also notice help with the craniosacral system, if I can keep my spine moving, I'm good. So just doing basic spinal rolls and moving my spine and keeping that pliable helps to keep everything else pliable. If you're able to and you know how to, headstands or shoulder stands are really good as well. Any sort of inversion can be helpful. I have clients rest their head on a bed, like I have them rest their head back so that they can get some more movement through the back of their head and kind of get blood flow to move in a little different way, because your head is hanging off, therefore it's inverting. So those are some different things that you can do as well, because it's where we create the tension that starts to block up the system. We have something that we call a still point. And when you have a still point induced, like you can actually manually induce or start a still point within your craniosacral system, what it causes it to do is it literally stops it for a moment, and then it'll start back up again. And when you do that, it's almost like hitting the restart button on your phone or your computer, and everything reboots. Ways that you can do that, I think Upledger sells something called a still point inducer. And an easy way, like if you don't want to buy something, you can get 2 tennis balls and wrap them in a sock, or you can tape them and they'll sit at the back of your head. You can also just interlace your fingers and your hands, and this aspect right here of your thumb, it's called the thenar eminence. You're going to rest that on the little nodules in the back of your head. So you're just going to come back, and it's like the guy at the desk is just chilling, and you can just sit back and let your head rest into that space, and you can actually induce a still point from that. And you'll feel it as you just rest there. Just close your eyes and take a few deep breaths. And when I do it, I feel like the back of my head starts to get warm and it gets soft, and then all of a sudden my neck releases. And so for me, when I'm able to remember to do that, that's the other thing, is remembering, I can feel that kind of system reset.
Okay, that's awesome.
Nice. Yeah, and so that place where you would stick your thumbs, that little hook on the back of your skull, that's where you would put the tennis balls, because they'll sit perfectly on the back of your head. If I had a skull, I would show you. But that's, I have one. But
I know, I was like, a separate
you do. But that's where you would kind of place that piece.
Okay.
And you can lay it on a hard surface. Don't do this in bed, but do it on the floor. And then you can put those there and you can rest there. And some people are like, well, how long? Start with like a couple minutes. And if you love it so much, you end up falling asleep there, you're not breaking anything. So just kind of being mindful and trusting that your body knows, and your body's going to tell you, this is really uncomfortable. I don't really want to be doing this right now. So then don't do it. Yeah. You know, and really listen. And I think those are going to be some key pieces to helping your system move.
I really like that. I haven't heard some of those things before, so that's super helpful and informative.
Yeah. And doing a still point if you have a fever will actually help to break the fever.
Oh, really?
I think it's because it's resetting the whole system, and it helps to boost the immune system. So again, getting all those different pieces to move the way that they're supposed to can help the body's physiology find homeostasis.
I would like for you to just let everyone know, like if they wanted to get in touch with you, to ask you more questions about the work that you do, if they're interested in getting some wellness coaching or some distance craniosacral, or anything like that, how can they get in touch with you?
So if anyone is interested in receiving any of that work, doing coaching work, or any of the distance craniosacral therapy at this time, really my email is the best way to get in touch with me. So that's emily@consciousllc.com. And a lot of times people don't get an email through because they don't spell conscious right. So it's CONSCIOUS, livingllc.com. That's the best way to get a hold of me right now. If you see a phone number listed with my name, it's probably not correct anymore. So shoot me an email and let me know, or you can find me on Facebook. I do have a Facebook page as well as an Instagram page. You can direct message me that way as well.
Awesome.
So, thank you, Liz, for having me a part of this. I love just seeing your smile.
You're so welcome. Thank you so much for taking so much time to talk to us today. You're just a plethora of knowledge. Thanks. And I like to tap into that. All right. Well, thank you so much. And I hope you enjoyed listening to our conversation.
Thank you.